I'm California Attorney General Rob Bonta, and I want to say thanks for joining me as I announce a lawsuit. I, as part of a coalition of 20 attorneys general, am filing today challenging the Trump administration for illegally sharing Californians' personal health data with the Immigration and Customs Enforcement Agency, also, of course, known as ICE. A move that's already having a chilling effect on Californians across the state. One provider we spoke to estimates that as much as 1/3 to 1/2 of recent no-shows at medical appointments have been out of fear of what might happen if they show up. And those are just the appointments that were made. There's no telling how many people are suffering at home, too scared to get the care that they actually need. No one should feel that way. No one should be afraid to get the medical treatment they need. Last month, the Department of Health and Human Services illegally, without warning or announcement, transferred Medicaid data files containing millions of individuals' personal health records to the Department of Homeland Security, which oversees ICE. Let's be clear about what's really happening here. President Trump, Secretary Kristi Noem, and Secretary Robert F. Kennedy Jr. are weaponizing Medicaid to fuel their anti-immigration campaign. They're threatening the personal health data of 78.4 million individuals who are enrolled in Medicaid and the Children's Health Insurance Program, CHIP, for their mass surveillance and federal immigration enforcement plans. We're talking about millions of people, including children, pregnant people, individuals with disabilities, and seniors whose privacy has been violated. This is about the federal government going back on its word after it promised the state of California and Medicaid enrollees that their information would be safeguarded. This is about flouting 7 decades of federal law, policy, and practice that have made it clear that personal healthcare data is confidential and can only be shared in certain narrow circumstances that benefit the public health or the Medicaid program. Privacy protections that DHS policy has until now acknowledged and respected. The Trump administration silently destroyed those longstanding guardrails when they transferred Medicaid data. As of January, 78.4 million individuals were enrolled in Medicaid and the Children's Health Insurance Program, or CHIP. Here in our state, 1 out of every 3 Californians are enrolled, including more than 2 million non-citizens. Individuals who rely on these programs for their primary and preventative care, oral health care, prescription drugs, behavioral health care, hospitalization, and other vital services, who rely on Medicaid to keep themselves and their loved ones healthy. And while Trump, Noem, and RFK Jr. may falsely tout that this will save money, the truth is the states are the ones who will be left to pay for their misdeeds. As terrified individuals opt out of Medicaid, states will receive less of the federal funding we need to support our residents, funding Congress has already authorized. The fact is, hospitals still have a legal obligation to treat patients in emergency situations when they walk into their emergency rooms, as they should, which means that state and private hospitals will bear the cost of caring for patients in dire conditions, conditions that earlier care maybe could have mitigated. But we won't get federal funding to cover the costs.